Okay, I'm entering the patient's room, closing the door for patient privacy. Hand sanitizing. Good morning, my name is Carla Johnson and I'll be your nurse today. May I please have your name?
It's Jones.
Okay, Mrs. Jones, may I please have your date of birth?
5/10/57.
5/10/57. Okay. I've assessed the environment for patient safety and body mechanics. Mrs. Jones, do you have any allergies to latex or medication?
Yes, I have allergy to tetracycline.
Tetracycline. And what happens when you take tetracycline?
I get a rash and I itch.
A rash and yick? Okay, I'll make note of that. And no latex allergies, correct?
Not that I know.
So the reason for our visit today is I am going to be performing a head-to-toe assessment on you, and it does require me to touch your body quite a bit. So I wanted to ask if you have any cultural or religious considerations that I should be aware of before we get started.
No.
No? Right. So I'm going to go ahead and just get started, and I'm going to be inspecting the patient's head. And I'm looking for any lumps or bumps. Hair distribution is normal. No presence of lice. Okay. All right. So next I'm going to go ahead and move forward, and I'm going to be checking your eyes. Do you have any corrective lenses or glasses that you wear?
Reading glasses, I just get them over the counter.
Over the counter? Okay. And you use your glasses for just reading and the computer, or do you use them for TV as well?
Just reading on the computer.
Okay, perfect. So this is my pen. I'm going to have you take a look and just don't move your head. Follow it with your eyes only, okay? Eyes are accommodating. Go ahead and take a look at this and just keep your eyes right on it. Eyes converge. Next, I'm going to use my light and I'm going to shine it in your eyes, and I'm checking to see that your pupils react. Good? Good, pupils react. Next, I'm going to be checking your ears, and I'm looking for any green. Okay? Ears look normal. As I was speaking to the patient, I was checking for assessment of speech, level of consciousness. Everything looks good, face is symmetrical. Next, I'm going to be checking your nose. I'm looking for any discharge. How is your breathing? Is it normal? Any difficulties?
No difficulty.
Are you able to differentiate between smells easily?
Yes.
You are?
Yes.
Okay, great. Nose looks clear, no discharge or drainage. Next, I'm moving on to your mouth. I'm checking the patient's mouth for gums, teeth, tongue. Go ahead and say ah and move your tongue. Do you wear any dentures?
No.
Go ahead and swallow for me. Any difficulty swallowing?
No.
Swallowing looks normal. Any history of smoking?
I don't smoke. I
No.
never have.
No e-cigarettes, nothing of that nature.
No.
Next, I'm going to be checking your neck. No presence of goiter. No tracheal shift. Palpating the lymph nodes for any swelling or abnormalities. Lymph nodes are normal. We're going to look to your left. No vein distension. To your right. No vein distension. Everything looks normal. Mrs. Jones, I'm going to be moving down to your extremities, okay? So I'm going to go ahead and just check your skin. Using the back of my hand, I'm checking the patient's skin temperature. Skin is intact. Skin is normal. No signs of cyanosis or jaundice. No rashes, scarring. Everything looks good. So to make this a little bit easier, I'm going to have you sit up, Mrs. Jones. Do you need any assistance? Got it? So I'm going to have you go ahead and just put your arms out. And I'm going to have you squeeze my hands. Squeeze, squeeze, squeeze. Perfect. Go ahead and relax. Put your hands like this. Put pressure to push my hands up. There we go. Push my hands down. Perfect. Next, I'm going to be checking the pulse, okay? So I'm checking your brachial pulse on each side. Brachial pulse is present and palpable on each arm. Radial pulse, present and palpable. Ulnar pulse, present and palpable. And right here at your clavicle, I'm going to give your skin a little bit of a pinch. I'm checking for hydration, okay? Skin turgor normal. Next, I'm going to go ahead and listen to your chest. And I'm just listening for heart sounds, okay? I'm going to lift your breast. Heart sounds are present and normal, strong. I'm going to palpate your chest now. You let me know if you feel any pain or discomfort. I'm checking for any lumps or masses. Feels normal. Skin color is normal, intact, no scarring, no bruising. How does that feel? Everything okay?
Yeah.
Perfect. All right. Lastly, I am going to have you extend out your hands again, just like this, and I'm going to check your fingers for capillary refill, okay? Easy. Right hand has normal capillary refill under 3 seconds. Left hand has normal capillary refill under 3 seconds. Perfect. All right, Mrs. Jones, I'm going to have you lay back down. And I'm going to take a listen to your lungs. Any history of coughing, difficulty breathing?
No.
None? I'm going to place my stethoscope on your chest. Each time you feel it move, take a breath, please. And if at any time you feel dizzy, you can stop. Breast sounds are present and normal. Moving on to your abdomen, I'm going to be palpating your abdomen in all 4 quadrants. I'm just feeling for any lumps or mass. You let me know if at any time you feel any pain or discomfort, okay? Palpating the patient's abdomen in all 4 quadrants. Muscle tone feels good. No presence of masses or lumps. And when was your last bowel movement, Mrs. Jones?
This morning.
This morning. Was it normal for you?
Yes.
Yes. Do you ever have any constipation or experience strain?
No.
Bloody stools?
No.
Good. Next, I'm just going to be listening for your bowel sounds, okay? Starting in the right lower quadrant. Right lower quadrant, bowel sounds are present. Right upper quadrant, bowel sounds are present. Left upper quadrant, bowel sounds are present. Left lower quadrant, bowel sounds are present. And Mrs. Jones, lastly with your abdomen, I am going to be doing a little bit of tapping to listen for sound. You let me know if anything causes you discomfort, okay?
Okay.
I would note that the patient's right lower quadrant does have a dull sound. Next, we would move to the perineal region. At this point, I would inspect the patient's vagina to make sure there was no redness, discharge, foul odor. And I would ask, do you have any problems with urinating?
No.
Any infrequency or incontinence?
No.
Any burning or pain or hesitation when you go to urinate?
No.
Any blood in the urine? No foul odors or discharge?
No. My urine, I drink a lot of water, so my urine is very light yellow.
Good. Okay, excellent. All right, right, Mrs. Jones, I'm going to have you turn onto your right side, and I am going to be inspecting your back and as well as checking breath sounds on your back, okay? So first I'm just going to go ahead, I'm going to palpate your back, and you let me know if at any point you feel any pain or discomfort.
Why are you taking it back?
Checking your back to make sure the skin's intact, that there's no redness or pressure point wounds. And I'm also checking the alignment of your spine. Make sure it's straight. Any pain?
No.
Discomfort?
No.
And I am checking the patient's coccyx, and it is normal, no redness, no open wounds. Skin is intact. Now I'm going to be checking for your breath sounds. As with the front, Mrs. Jones, I'll have you take a deep breath every time my stethoscope moves. And if you feel lightheaded, we can go ahead and take a break. What sounds are present and good? I'll have you lie back on your back. Let's go ahead and check range of motion in your arms as well, okay? If you'd like, yes, please. Okay? So go ahead and just shrug your shoulders for me. And one more time. Any pain or discomfort?
No.
Go ahead and just check range of motion on those arms. How does that feel? Any pain?
No.
Discomfort?
No.
Do you ever have any issues with performing your regular daily activities with your arms or shoulders?
No.
All right, thank you. I'll have you lay back down. How are we doing?
Good, thank you.
All right, Mrs. Jones, I am going to be moving your gown up, okay? And I'm moving it up just to the middle of your thigh because I'm going to be inspecting your lower extremities. Okay? Checking the patient's leg, palpating. Looking for edema, discoloration. Skin's normal and intact. No presence of edema. Temperature feels good. Skin color is normal. Checking the backs of the calves for heat. Normal. Now I'm going to check behind your knees for your popliteal pulse, okay? Doing it on both sides to make sure it's present and even. Popliteal pulse is present and palpable. Checking your dorsal. Pulse is present and palpable on both feet and your tibialis. Pulse is present and palpable in both. Do you ever have any problems or pain with walking, standing, sitting?
Only my left knee intermittently when I exercise.
Okay, so you have pain in your left knee when you exercise.
Sometimes.
Okay. And would you describe that pain on a 0 to 10?
6.
Okay. And what does the pain feel like?
Still 8.
Still on 8? Do you take any medication to help with the pain?
Usually I just rest. Once in a while, if it's really bad, I take ibuprofen.
Ibuprofen? Okay. And when you take ibuprofen, how many milligrams?
500.
500? Okay. And just once a day, twice a day?
Just once and it works.
Okay.
Makes it a 0.
So you find relief in taking one 500 milligram ibuprofen?
Yes.
Okay. Perfect.
Oh wait, 500 100. I can't remember.
It probably comes in increments of 2, so it could be 400 or 600, just depends.
I'm pretty sure it's 400.
Okay, no problem. I'll make note of that in your chart. Okay, last I'm going to be checking your feet. Everything looks normal, skin is intact, no bruising, scarring. And I'm going to be pinching your toes. I'm checking for capillary refill, okay? Capillary refill in right foot is normal and under 3 seconds. Capillary refill in left foot is normal and under 3 seconds. Okay, Mrs. Jones, I'm going to lower your gown. We're almost finished here. I'm going to have you sit up. How are we doing? Good. Lastly, I just have a few questions for you. I wanted to know if you ever have thoughts of any suicide or hurting yourself.
No.
Do you ever have thoughts of hurting anybody else?
No.
No? Okay. Do you feel safe here?
Yes.
Do you feel safe at home?
Yes.
Perfect, thank you. Do you have any other questions for me today?
No, you did a great job.
Perfect, thank you. All right, Mrs. Jones, I'm gonna have you lie back down. Are you comfortable?
Yes.
Can I get you anything? Raising the patient's bed rails, locking the bed in place. I'm gonna hand you this call light. If you need anything, go ahead and press the button on top and someone will be in here shortly, okay? All right, Mrs. Jones, I'm gonna let the doctor know you're ready. You have a nice day, okay?
Thank you.
Thank you.